We got Dr. Neil Nathan back. I think this is podcast number 3 that we've done together. So thank you so much for reaching out. Your team reached out and said, "Hey, we've got a second edition. Would you like to chat?" And the answer is, of course, always, because you've got more and more people every day. And now with the number of influencers on the internet, you're seeing new videos, at least I am, on a monthly basis of people that are suffering from stachybotrys and aspergillus and figuring out that their dream home that they moved into to renovate was actually contaminated with mold. So I think even in the last, I think you and I have been chatting together for at least the last 5 years or so. I think even in the last 5 years, there's been a huge, huge awareness. And I definitely got to give you your credit there for the book. You've done amazing with that book. And it looks like the second edition is off to a great start too. And now with Instagram videos and YouTube videos, it seems that these people, particularly people that have millions of followers in some cases, getting sick from mold. In a way, it's almost a good thing that this is becoming highly publicized. In fact, just last night there was a guy named Chris Williamson. This guy here, and he's got millions and millions of followers. He's a popular podcast host. He interviewed Matthew McConaughey recently, and he just did this huge video about his health. And in that video, he discusses not only his struggle with Lyme, but also mold. And that video is going to go on to do millions of views. So I just wanted to kind of brief you and the audience on that the tide is turning and people are still waking up. I think the vast majority of people are still asleep. They still judge me for talking about mold. I've had family members make fun of me and say it's crazy. This is all in your head. What's wrong with you? You just need to chill out and listen to Pink Floyd. Um, but this is very real. And so I just wondered uh, what your pulse is on this awareness, maybe the last few years, and where do you think things are headed?
Well, let me put that in historical perspective. I first heard about mold toxicity in 2005 when a patient came into my office and plunked Dr. Shoemaker's book, Mold Warriors, down on my desk and said, "Here, read this." And I said, "Okay." Now I read voraciously, so there are lots of books on my desk at this point. So I just stick it on top of the pile. And she says, "No, I don't think you understand. I want you to read it right now. I'm paying you to read this book right now." And I went, "Fabulous. I love to read. You're going to pay me to read? Absolutely cool." And so I started reading the book, and fortunately for her, early on in the book, Dr. Shoemaker laid out his biotoxin pathway. And when I read that, I went, wow, this guy is really onto something here. This puts together a whole lot of information that I've never seen put together this way before. So I literally called him with her sitting in my office, called his office and said, "Can I come down and spend some time with you?" And I did. Within a couple of weeks, I was on a plane to Pocomoke, Maryland, and started working with him. So in the intervening 20 years, there has been a wonderful increased awareness of how important mold toxicity is. It still hasn't reached conventional medicine to the extent that we need it to. So millions of people are going to their doctors with mold toxicity symptoms and being told, "Oh, this is in your head," or "This is you're a hypochondriac," or "No one could have all those symptoms," or and that's a travesty. But we are making inroads. For me, this is all about consciousness, if you will, like um, increasing the consciousness of patients and physicians that this is a major, important component to people's health, needs to be taken seriously. A quickie in this regard, by the way, one of my colleagues, Joe Mather, just put a YouTube video together in which he talks about the science behind mold toxicity. And I've known Joe for a long time. And so for your listening audience, um, Joe literally says, "I'm just tired of people saying that this is a made up field or there's nothing to it or there's no science behind it." He said, "Here it is. And so in about a 12-minute video, Joe begins the process of laying out the science behind mold toxicity, published papers, what we know about it. This is not simply my experience or your experience, but it's no, there are hundreds and hundreds of published papers in the medical literature which lay out that, yes, this is a very real thing and we have to take it seriously. So I just wanted your audience to know about Joe's video because I'd like that to go viral.
Yeah, I see his YouTube channel here. I also see an interview that you and him did a month ago on his channel. So, oh, here we go. Mold toxicity is real. Here's the science. Yeah,
Yep,
there's a
yep,
2 week.
yep, yep,
Yeah.
yep, yep,
So
yeah. That's it.
we'll link to that and we'll put that in the show notes for people because I still hear molds everywhere. That's still the way that people try to blow me off when I bring this up, and it's 98% men. I don't know what our problem is. I don't know if it's our egos, our testosterone, but the ladies get it. The females understand this is a real issue. What do you think about that? And have you seen that over the years with your clinical practice too, more so that men are maybe stubborn or less believing of this than women?
There is that tendency. Um, for a lot of the men, they're looking at their wives telling them, I think I have mold toxicity. I think we need to look at this house and figure out where it is and remediate it so that we can get better. And I think it's a male trait to go, um, oh, it can't be. I think it's a denial process, which is I don't want to deal with the possibility that I'm going to have to put potentially tens of thousands of dollars into remediating this place. I don't want to even think about it. The second piece of that, Evan, is I think women are generally more sensitive and aware than men are. I think they're wired that way. And so I think that women would be more prone to be able to smell or to sense mold in their environment than males. And I don't mean that in a derogatory way. It's just that I think women are biologically wired to be more sensitive. I mean, certainly there's tons of sensitive men on this planet. I kind of like to think I might be one, but um, I think that's a tendency. So I think your observation is correct.
You know what's interesting? I was trying to look up real quick about the amygdala. And is it possible that there was a difference in size maybe in the limbic system directly? So this Stanford magazine article popped up about the amygdala, and it is saying here that it is generally bigger in a male, which is interesting. So I don't know how that would play in. You know, this article is kind of questioning how that would play into depression and anxiety rates and stuff like that. Uh, but
At,
it's,
at the risk of provoking a size doesn't matter argument,
yeah.
um, I'm I'm not aware that the size of the amygdala matters. What matters is the sensitivity of it and the wiring of it.
Hmm.
And mold toxicity and separately mast cell activation cause an inflammatory reaction in the amygdala, which is what sets off a whole lot of the symptoms that we're dealing with.
Yeah, this is a very important situation. I want to read something from your book that I really appreciated, you know, because I'm seeing on a weekly basis so many people. I now do a functional medicine group, which has been a blast. We've had over 1,200 people go through it where we meet and we look at labs. So we look at mycotoxin profiles, we look at organic acids, we look at mold colonization on oats, we look at GI maps, and it's been just a ton of fun. But something really resonated with me in the books. I want to read this back just to kind of celebrate this part that you wrote, but then also let folks hear this because this is a reality of working with chronically ill and in many cases complex cases that you get these notchers, these belt notchers. And so you wrote here that you look for notchers, you know, working clinically, and that in the old west, gunslingers who survived a shootout would put a notch in their belt for every victory. Notchers is is your name for patients who come to me having seen a wide variety of truly excellent practitioners, none who have been able to help. In your younger days, when your ego was still up and running, I love that part. I fantasized I would help these people, demonstrating my superior clinical skills to all. With rare exceptions, was I ever wrong? After a few difficult months of half hearted effort, these patients left my practice with one more notch in their belt. It took me a long time to realize they really didn't want my help. Their goal was to prove that they and their illness were so special that no one could help them. A visit to me added weight to that self fulfilling prophecy, and then they were off to see another wizard. And then I want to hit this part too, because this is like you hit it home here. Finally, I try to screen out the patients who are chaos driven. Some people do not feel fully alive unless their world is falling apart. Patients with personality disorders, including narcissists, fall into this category. And so you go on and on about that, but I've experienced that where when things are getting better, it's almost like the people don't want to believe it and they want to sabotage the progress somehow. And so they'll go and take, for example, we had a guy in Colorado who was taking BB1 for Borrelia from Beyond Balance, which I know you know well. And I told him, hey, we're going to max out at maybe 5 drops twice a day. Well, his ego driven attitude and he wants to push through and see how far he can go. He goes up to 20 drops twice a day. And he was a contractor. He was standing on top of a building and walked to the edge of the building, 20 something stories up, and luckily caught himself before going off the edge. And so it's almost as if sometimes these people want to just they want to push 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 or they want to sabotage themselves. And so I really appreciate that you put that in there because when you're on the helper side, you're trying to help these folks, you assume that everyone's coming in relatively the same. Like they're going to do what you tell them, they're going to follow the protocol, they're going to positively believe that they can get better. But I've also beat my head against the wall sometimes where you see these people where you're bending over backwards, you're responding to their emails as quick as you can, and you're even doing after hours calls for these people sometime to squeeze them in, and it's still never enough. So I don't really have a question for you about that. I just wanted to say thanks for calling that out because I think that's a piece of medicine that people don't even know exist. And especially when you're doing virtual calls, when you're doing telemedicine, if you're in a doctor's office, it would be okay and socially acceptable for you to be 20 minutes late. But if you're 2 minutes late to a telemedicine call and they're already emailing or calling the office or texting the office, it's 12:02, where's Dr. Nathan? That's kind of a wild expectation to try and meet.
So let's separate that because I think there's more in there, Evan. Let's unpack it a little bit. So first of all, yes, there are notchers. Um, the essence of the notcher, as I wrote about, was that their need to be so special and unique is so great that they would rather not get well, but be able to say to the world, I've seen, and they will list some of the top docs in the country, and none of them have been able to help me. Message here is that's because I'm so special. That's a certain type of pathology that is different. The case that you're talking about of this fellow who didn't listen to what you said and took much more of that particular tincture than they should have and had a fairly severe reaction to it, I think that's different. Um, a lot of the people that I work with are type A in behavior. They're successful, bright people. They've gotten through life by pushing and pushing and getting forward. They're successful. They have been. And for many of these people who are now sick with mold toxicity or Lyme disease or combinations of it, they are baffled that the way that they have dealt with the world by pushing no longer works. It's backfiring for them. It's like, wait a minute, I've gotten successful by having this can-do attitude and overdoing throughout my life, and now it's worse. I think that's not understanding that they need to listen to their body in order to get well, that you can't just bull your way through it, that, a motto that I've had for years is if some is good, more is not necessarily better. And I caution virtually every patient at every discussion of please don't push. Please don't. what you have done all your life is not going to work here. You need to learn from this life experience how to have another gear. Another way I used to joke about it would be I tell patients, it looks to me like you have two gears, which is um, overdrive and burnout or, or doing nothing. And you need to add a few gears here so that depending on what it is you want to do in life, you can use the right gear to get you where you're going in the right way. And so I think that's a different piece of what you're describing.
Yeah, definitely. And that Chris Williamson guy I brought up in the beginning who put this big YouTube video out, I know it's going to go on to get millions of views. He said in that video that for the first time in his life, pushing harder didn't work.
Yeah.
And he was simultaneously, apparently, I didn't get the full story yet, so don't quote me exactly, but it sounds like he was battling both Stachybotrys as well as Lyme at the same time. And that was my triple whammy. I had Lyme, I had Bartonella, Babesia, and mold all in the same summer. I had 3 tick bites and mold exposure in the same summer, and it knocked me down pretty hard. And luckily, I can say every conversation that you and I have, I'm better than I was the last time we talked. And I've learned about the gears. And I think what gets people in trouble too is if they do start to see a glimmer of hope, they do start to feel some relief, they use it as an opportunity to completely go off the rails and go back to doing the things that messed them up in the first place, being alcohol. We know alcohol is depleting DAO and worsening histamine problems. They're getting back on processed foods. They're getting back on gluten or dairy or excess sugar, or they're staying up too late, or they're signing up for a marathon because now all of a sudden their mitochondria are working good enough to run again. And then they come back 2 years later and they've completely crashed. And so I agree with you, and I would caution people to take your wins and celebrate those wins, but also don't go sign up for a 5K the first month you start to feel like you're recovering from 20 years of chronic fatigue syndrome.
Yeah. That is a problem that I see often. And again, I try to caution patients as they start getting better. Um, I'll tell them, there's a whole lot of things you put on hold when you were sick and you weren't able to do it. Please don't try to do everything on that list in the first week that you feel better, or you're basically going to deplete your energy stores and you don't even have any energy stores. I try to educate patients that your mitochondria have been profoundly affected by your illness, and it'll take a while for them to get better. Even when the mold is completely out of your body, it may take you 6 months to a year to really restore your energy reserves, for your mitochondria to truly heal. So please don't push it. It's not gonna, it will not go well for you to do that.
Yeah, I want to talk about mental health issues. This is huge. We know depression is still one of the leading causes of disability in the US. Thanks to your book and the chapter that you had in there about ketamine. And then also, I interviewed an MD out of Southern California named Dr. Stephanie Coleman. She runs a intramuscular ketamine practice. I'd been through several sessions of it. I think I've probably done 9 or so sessions of ketamine. I first wondered if you had tried ketamine yet. And then, two, I want to get into the mental health piece of all this, the mast cell piece, depression, anxiety, panic, and all the issues that can happen mentally, and how conventional medicine is completely failing by just prescribing antidepressants and anti-anxiety meds, benzodiazepines with horrible withdrawals, and how really we need to dig deeper to fix the mental health.
Yeah, I just a couple of weeks ago lectured at an IMMH meeting. It's a group of psychiatrists and psychologists who are understanding that the decades-old way of treating mental health, which is to use medication to try to change neurotransmitter amounts in the brain, has not worked. And there's some new research showing that the whole concept, which has been the backbone of psychiatry for years, is that, for example, depression is a serotonin deficiency. And we're learning that's not the case. And uh, for years, medication has been the major use to do so. But when you really look at the studies, none of the medications work that well, and certainly not for a period of time. So we've been missing the cause. And I think for me, that's been my major problem with the psychiatric profession, which is Okay, you can say you have anxiety, you have depression, you have OCD, you have depersonalization, derealization. Those are labels, but putting a label on it and giving you a medication for it does not address the cause. And if we're not looking at the cause, then what are we doing? And the cause for many patients with psychiatric labels is mold toxicity, Lyme disease, Bartonella, and a whole bunch of other biochemical imbalances that need to be looked at. And this group, IMMH, is spearheading in the profession the understanding that we need to approach this differently. We need to really be looking at our patients' biochemistry. Examples would be if the balance between zinc and copper in the body is off, that predisposes to anxiety and depression. If the body's not methylating properly, that predisposes to anxiety and depression. And if there are a buildup of what are called paroles or cryptoparoles in the body, that predisposes to depression and anxiety. So we're beginning to be able to identify a simple tests that we can do to help people rebalance their whole bodies differently.
Yeah, I got exposed to the whole cryptopyrrole thing probably a decade ago. I remember running my first urinary cryptopyrrole test and I was off the charts. So I'm significantly better now. But I interviewed Dr. Albert Mensa. I don't know if you had heard of Mensa.
I know him.
Okay, cool. So I chatted with him years ago, and that blew my mind, this whole concept. I started looking at everything differently back then, and now I still think many people are missing that, though. It's still very rare to see a cryptopyro test come in from let's say, a patient that's already been to 20 doctors. I'm maybe once a year do I see someone that's tested that.
Yeah, I recommend that all people with anxiety and depression get a test for mold, get a test for Lyme and Bartonella, get their zinc and copper levels checked, methylation checked, and check for cryptopearls. That should be standard because all of these are treatable imbalances. It's not that we're just identifying, yep, that's a messed up part of your chemistry. We can fix that. So it behooves us to not do very straightforward things that will cure people if we only look for it.
Agreed. Well, I get annoyed too when people just blame it all on genetics. Well, my mom was depressed and my dad was anxious and whatever. I'm like, so what? I mean, yeah, that's an important piece of the puzzle for me to hear, but your issues are happening in your body. Your mother's vitamin B6 deficiency, which is causing the issue with the elevated, cryptopyrroles and her zinc copper ratio. Did maybe some of that affect your levels? Yeah, but we got to fix you. So, yes, we can look in the mirror and see what happened behind us in the previous generations, but you can be fixed. But once again, this goes back to people almost being addicted, as you call it, addicted to the chaos of their life. They almost identify as, I am depressed, I am anxious, and they walk around like it's a badge, like you're at a conference with a sticker, hello, my name is depressed. They almost embrace that. And for me, I mean, I had mood issues as long as I could remember. I remember being 9 years old in my grandmother's moldy basement, just feeling depressed. I didn't even know what depression was, but here I am, 9 years old, her basement flooded. She had carpet down there. She had wood panel walls, typical 1970s decor. They dried it out with box fans. It took 2 to 3 weeks to dry out. There was, you could splash. There was so much water in that basement. And I remember not only having what I think of now as an adult as depression, but my feet used to be so cold in that basement, I would have to have a space heater to keep my toes warm. And so I think I was already having circulatory issues from this exposure. I know you and I've talked a little in the past about the issue of nitric oxide. We've talked a little bit about VEGF being affected. But this circulatory blood flow thing, that's directly contributing to your mood issues as well. And so I know when you improve blood flow, not only does your circulatory system improve, but your mood improves as well. Back to ketamine. Have you done ketamine? Have you gone through any of the IV sessions?
Okay, well, I've never felt a need for it, to be honest, so I
Mhm.
have not done ketamine myself.
Okay.
However, we used to do IV ketamine in my clinic, so I have a fair amount of experience with it. I'm a big fan. Low dose ketamine can be a game changer for people with severe anxiety or depression or mast cell issues. It can literally reboot a system that is having trouble rebooting itself. So I'm a big fan. But no, I haven't done it myself.
I think it would blow your mind. I think you would absolutely love it, and you wish you did it 40 years sooner. Because after reading your book, your first copy that came out in 2018, for me clinically, I feel a little odd recommending something that I haven't done personally. Pretty much everything I recommend, I've been through hell and back, and I'm like, okay, I've been there, I've done this, I've tried this, and ketamine was one of those things that I looked at, and my bias was more towards natural medicines, looking at the studies on microdosing psilocybin, for example, seeing what that's doing to help reset the amygdala. There's some good papers coming out now from MAPS, which I'm sure you're familiar with, on PTSD and trauma and reversing that using plant based compounds. So, ketamine being synthetic, I was a little bit apprehensive, but I thought, you know what, I've got nothing to lose. And at one point, my chemical sensitivity was so debilitating. I felt like I had no choice. Your mind is so clear headed while you're on it. So I ended up going to around 1 milligram per kilogram. I don't know what you consider a small dose, or you called it
Yeah,
a
yeah.
maybe
A low
a
dose
low
in my
dose.
experience, that again depends on how sensitive the patient is.
Okay.
We've had a few patients who are so sensitive and so fearful
Yeah.
that we needed to start at like 5 or 10 milligrams IV and let them know, yes, I can do that and that's safe. Normally, we would start people at 25 milligrams, maybe bring it up to 50. Higher doses have been used in pain clinics for a long time to help reverse some severe pain syndromes that were not being touched in any other way. People with reflex sympathetic dystrophy, things of that nature. So those are the doses that I'm used to.
Yeah,
Uh,
that sounds right. That sounds close to where I was. I think I went eventually to 1 milligram per kilogram, which was definitely in some cases a little strong. I mean, you're definitely out of body, definitely a psychedelic experience,
that, that
but
that still falls into my category of if some is good, more is not necessarily better.
yeah, yeah. I only so the only side effects, so to speak, which I was very fortunate because the nurses at the clinic were very open to my herbalism background, and I said, hey, instead of Zofran beforehand, because they pretty much that was their standard protocol was administering Zofran, which for folks listening, that is a anti-nausea medication. They'll pass it out in the hospital like candy if you're having vomiting. I brought in a study on my phone of Zofran versus ginger. And so I was very fortunate the clinic listened, and now they pass out ginger candy instead of Zofran. They no longer use Zofran. The other thing they did was they used beta blocker at the beginning of the ketamine due to the potential rise in blood pressure. And I said, well, let's try motherwort instead. And they had such good success with motherwort, which I've loved and used for a decade for anxiety and panic and headaches and PMS and hot flashes. And sure enough, they said, "Wow, this is so effective. We no longer need the beta blocker anymore." So now it's literally ginger, motherwort, and ketamine is the three combo they're using. And I would say on the first dose, the first 1 hour session, probably reduced my chemical sensitivity by 50%.
Yeah, as I said, it can be a game changer.
It's hard to believe.
If, sometimes the body needs to be rebooted and doesn't know how to reboot itself. And
Yeah.
so some of the things that we do could be helpful.
What else
Along,
are you doing in your personal life to keep yourself regulated or to keep yourself not in fight or flight? And if you had another thought coming, finish that.
I did. So I'll answer your question, then I'll get to the other thought. Um, um, so first of all, um, I walk at least 2 miles a day. I do Tai Chi, Pilates, I bicycle, I meditate, um, as and probably the biggest piece of it, I live in a natural setting. I mean, I'm talking to you now from my office. Right in front of me is a wild park in a little town in southern Oregon. And literally, I have deer right now in front of me and turkey running around in front of me. And I can see the ocean, the Pacific Ocean, right over here. So for me, being in a natural setting is the single most important component to allowing my nervous system to deal with all the things I have to deal with on a regular basis comfortably. Um, and at least as important to that is um, I'm head over heels in love with my wife and have been for 35 years. Um, I have two fabulous puppies that give me unconditional love every day. I've got great kids. So basically, I have a blessed life. And um, within that context, that gives me the support I need to do the work that I do, working with complicated, difficult patients and then trying to move this whole field together. To come back to what I wanted to segue into, I wanted to be sure that your listening audience is aware that we can reboot our limbic and vagal systems, that we're not victims here. We don't have to be anxious and depressed and go, oh, this is terrible, and I have no life here. We can, if you will, grab the bull by the horns and learn how to regulate our nervous systems. And I really want to emphasize that we have multiple ways that are very effective of rebooting our limbic systems. And I hope that all listeners will consider doing those things on a regular basis because in this very stressful world that we all live in, you can't get away from it. We need to actively be doing that rebooting on a regular basis in order to be able to stay high functioning.
Yeah, amen. Here's a paper that I've loved for years now. This is one that came out in 2019. There was some prior papers on this as well. This is in Frontiers in Public Health Studies titled "Combined Effect of Walking in Forest Environment on Salivary Cortisol Concentration." They took 74 patients. They had them walk for 15 minutes in a forested area and also an urban environment. What they found is that walking in the forested environment decreased the cortisol pretty good amount, whereas walking in the urban environment, as they say here, quote, barely changed cortisol concentration. And there's also papers on NK killer cell production. All the forest bathing studies show that even just 2 hours in the woods can boost your NK killer cells for a significant amount of time. There was another paper that showed that if you're actually camping out in the woods for 2 to 3 days, you're getting exposed to all the phytoncides from the trees. 2 to 3 days of forested camping boosted NK killer cells for up to 3 months. So literally, you take one weekend to go camping for a couple of days or glamping if you don't want to sleep on the ground, and you're literally improving immune health. And I appreciate you bringing that up because many, many years ago, I was working in a park system and we were building hiking trails. And I was like a jungle boy. I mean, I was literally in the woods for, 30, 40 hours a week. And my stress response was so healthy, nothing at all would frazzle me back then. Like I wasn't in front of a screen, I wasn't on a computer, I wasn't exposed to Wi-Fi. I was in the middle of, potentially 15, 20,000 acres at a time. And I never really felt that overwhelm like I did in the city. And so it's great to hear that from you because many people are looking for the next biohack. Like especially people that have the money to buy expensive toys. What about this hyperbaric oxygen or what about this $10,000 red light therapy sauna device, which okay, there's a place for those, but this idea that we have to keep swiping the credit card to heal or that we have to have this huge budget. And sometimes I'll get hate comments on my page. Must be nice. You got to be rich to get healthy. You got to be wealthy to da da da. The stuff you're describing can be done for free. There's how many millions of acres of public national land in the United States alone where you can get away from the system. And in fact, some of the people that have done the best are the people who take this mold sabbatical and they just literally go out to New Mexico or Utah for a week or a month and it's cost little to nothing and they heal.
Yeah, big fan. I grew up camping, so um, it's interesting. My kids, when we asked them about the various things we took them to when they were little, don't remember Disneyland at all. But what they remember most uh, is our canoe trips that we took to in the Minnesota um, lakes where we'd go out for a weekend or a longer period of time and we'd paddle out, we'd portage a couple of lakes to get into a more remote area, and we would fish and look at the wildlife around us. Moose would wander through the campsite periodically. That they remember. Of all of the various childhood experiences, that is the one that somehow resonated for them the most. And um, I think that's a gift that we can give our kids. You don't have to spend beaucoup bucks to take them to Disney World. You can, rent a cabin in the woods somewhere. And as you're saying, I think those effects can be profound on the whole family.
Yeah, I saw a study on expenses for your average Disney World trip, and the average family is spending between $5,000 and $8,000 for a trip to Disney World. And last time I checked, most state park passes are $20 or less. So for a night or for a weekend potentially. So this is a huge switch for our DNA. I mean, obviously we've been in nature. We evolved to be in nature 99% of the time. It's only very recently we went from in the 1800s being primarily in farmer society, farmer civilization, to now we're on average 95% of the time people are indoors. So it makes sense. And of course, if you're indoors breathing in mycotoxins, right, it makes sense that this epidemic of the mental health, the mold illness is all happening at the same time we're ditching nature and we're coming into these boxes. So I hope that message comes clear to you guys. It's very simple at the end of the day. It's very elegant, but very simple. Even this morning, before I did a group call this morning and then jumped right over here to you, I was debating staying home because I thought, okay, you know what? I got to finish Dr. Nathan's book. I want to make sure I didn't miss anything. I'm going to just stay home. And I told my wife, you know what? I'm going to read the book in the car. I'm going to the beach with you this morning. And so I went swimming for about an hour this morning. And that was the perfect reset. And it just totally cleared that the feeling of stress. I mean, I could look at my calendar and go, wow, that's stressful. But the more I'm in nature, pushing on the bike, swimming, all of a sudden I see the stress, but I'm not connected to it in the same way.
Yeah, good choice.
Yeah, I appreciate that. Well, I want to know, where do you see the future of uh, natural medicine specifically with mold? Because there's still a lot of practitioners pushing this shoemaker only protocol, which you've talked about extensively in your book and other interviews we've done. You've got to have cholestyramine, you've got to have this and that. But I'm seeing people getting better without pharmaceuticals. I'm just wondering, are you thinking that the pharmaceuticals are they're here to stay, or you think we're going to get to a point with the peptides and the nutraceuticals that maybe we use less pharmaceuticals? What's your pulse on this?
Well, from my perspective, treating mold toxicity is a threefold process. First, the person needs to be clear as to where they're getting exposed: home, work, car, at a parent's home, or wherever it is. And they need to get out of that exposure. You won't be able to get well if you're staying exposed. That is super important and complicated and difficult for a lot of people. Second, that we need to take the binders that are specific for the mycotoxins that we're finding in your urine. And there's a expanded table in my new book. We've learned a bunch of that over the last few years. So there's literally a table in there which is based on research, which is which binders bind which mycotoxins the best. And you can literally look up if you've got ochratoxin in your urine, you can look it up and go, okay, cholestyramine, Welchol, and charcoal are the best binders for that. But in answer to your question, I think that pharmaceuticals have their place. Um, if someone has just been exposed, and that could mean in the last 3 or 4 months, I don't mean just yesterday, and they haven't colonized yet, just taking binders may be sufficient to get them well if they get out of that exposure. But if they've been in that mold environment for a longer time, and most of the people that I work with have been unfortunate enough not to have anybody raise the possibility of mold toxicity. So they've been exposed for years, not been treated, and then that mold toxicity is such that they've colonized, usually in their gut or sinus areas, and that usually will require antifungal treatments. Sometimes botanicals are sufficient, and sometimes they need to take pharmaceuticals in order to be able to get that out of their body. So for me, it's the whatever tool I need to do to help that patient, that's the one that I want to do. Um, Honestly, it is rare for the people that I see to not need antifungals in some form
Yeah, and you're
because
talking up the nose and in the gut, correct?
yes,
Hmm.
yeah, that's correct. Um, so that again, that's been my experience, but my experience is colored by the fact that the vast majority of people who come to me have already been treated by other practitioners and not succeeding. So I'm generally seeing more complicated, sicker people. And in that population, that's true.
Yeah, just for folks that are listening, when we're talking about colonization, if you're watching the video here, a lot of times we're using organic acids testing to help us, and we can't test all the molds. I do hope in the future. I'd like to hear your idea on this. I know you being in the industry for a while now, you probably hear some stuff on the horizon. I'm hoping we're going to be able to see more things, but right now we can at least see what we know are these organic acids related to Aspergillus and Fusarium. I hope that more will be able to be tested on an oat, but like in this female here, we can see this marker furan 2,5 dicarbolic acid is elevated. And so that tells us right there, okay, there's some Aspergillus issue, which in her case, it perfectly correlated to the testing of her home. So it's great if we can connect the lab to the home, but in some cases, it doesn't match up at all. And we're finding these people had exposure from 20, 30 years ago, and they're just still walking around sick.
Right. The difficulty in matching, and I know people like it to match, which is I want what's in my urine today to match what's we're measuring in my house. But as you're alluding to, and I think it's very important, many people's exposure was long time ago. And those molds are still in their body making these mycotoxins. They may have moved out of that house 10 years ago, but they're still carrying the molds that are making the mycotoxins in their body ongoing. So there is not a clear um, match that we can give them. I know they, for medical legal purposes, like, no, I want to prove that what I'm exposed to is what's there, but it could be from a long time ago.
I appreciate you saying that because we get that as well. People that are saying, "Oh, we're going to sue so and so. We need to prove that what you saw here is here in the builder," and it's like, "Whoa, this is crazy."
Yeah, can't do that. Bodies are a little bit more complicated.
Yeah, yeah, we're not as so robotic. Let's finish up on mast cell and neuropsychiatric issues. We talked about this a little bit before we hit record, which is this idea that there can be, as we see in the literature, and there's many more papers like this, there can be major, major neuropsychiatric effects of mast cell. Anything from dysautonomia and depression, generalized anxiety disorder, headaches. You've got OCD. You've got ADHD, phobias, even bipolar disorder. And I just wanted you to kind of unpack this a little bit because one of the biggest complaints that I hear from people is chronic fatigue, but then mood issues right after that, typically irritability. And a lot of times it's parents that are completely overstimulated by having young kids or grandkids around and they can't handle the screaming and the crying and the noise sensitivity and the bright lights and turn that off and turn that down. And it's just this massive irritable overwhelm combo. I think a lot of that is coming from mast cell because me personally, after ketamine, I noticed my mast cells were so quiet that I'm not a person who goes around and wears sunglasses typically, unless I'm on a boat and I'm going fast and don't want to get hit in the face with a bug. But I noticed I could handle even brighter lights. I could notice even louder sounds didn't get to me the same way, almost as if the mast cells were causing that kind of sound overload. So I just wanted to hear you unpack that a little bit.
So let's expand that discussion a little bit. Ketamine doesn't just work on the mast cells, it also works on the limbic system. And the limbic system, vagal nerve system, and mast cell system are completely, totally interwoven. Each affects the other. So it's almost impossible to have a mast cell issue and not have a limbic and vagal system as well. So if we're going to be treating mast cells, it isn't just that treatment, but people need to understand that they need to work on their limbic and vagal systems, all of which are triggered by mold toxicity, Lyme, Bartonella, the combinations of those, so that those are the cause. If you were to just treat mast cell activation, yeah, you can get better. It's kind of like putting a Band-Aid on it, but you want to fix what's causing it in the first place to make it well. So to expand that discussion, um, you need to be conscious of limbic, vagal, and mast cell issues if we're thinking about neuropsychiatrically. When the limbic system is involved, we're dealing with any exacerbation of any underlying psychiatric condition or a new one. So someone who's never been anxious, but now has panic episodes and is anxious out of the blue for no reason, um, that's their limbic system. The limbic system also controls sensitivity. So if someone is more sensitive, as you're describing, to light, sound, chemicals, touch, food, EMFs, which is a big one, which we haven't even gotten into, that's all limbic. So the limbic system has to be rebooted with the vagal and mast cell systems for a more comprehensive reboot.
Yeah. And this is why someone just taking quercetin is not going to fully get better. They say, oh, I took the histamine reducing supplement or I took the DAO and they're not better. And it's
Right.
like, yeah, you are running from a bear and you're overworked and overscheduled and you have no time for yourself and you don't go for walks and you don't go in nature. You're in this fluorescent lit office all day. So, um,
Yeah, but a single supplement or drug is not going to fix mast cell activation. Mast cell activation is very complicated. Mast cells, when activated, are known to make over 1,000 different biochemical mediators, most of which will cause inflammation to some extent, often aggravating the underlying inflammation that's triggering these people in the first place. So a single material like quercetin, which is a mast cell stabilizer, by itself will rarely make that much of a difference. You almost always need to take a mast cell stabilizer with an, a histamine H1 and H2 receptor blocker, with DAO, which is an enzyme that the body uses to break down excessive histamine. And there's a number of other materials that need to be included in that process if we're going to quiet down the mast cells. And as I'm saying, if we're not including limbic and vagal retraining at the same time, not likely to be successful.
Yeah, well said. I popped up a picture here for folks. If you're on
Yep.
the video, you'll see degranulation of mast cells. And so essentially, what he's describing is that, yeah, you can patch up these mast cells by using quercetin or Perea, all these things to help. But at the end of the day, we've got to quiet the nervous system from activating these things. And so if you think you're going to supplement your way out of it, unfortunately, you probably won't. And I had to learn that the hard way. What do you think about this idea of curing Lyme? I get asked that all the time, and I'm like, I need to ask somebody else because they keep asking me. And I'm like, I think it's controversial. I've looked at autopsy studies. Borrelia is everywhere. It's in the brain, the liver, the kidneys, the adrenals. We know it's in the bones. So people ask me, Evan, can I cure my Lyme? I tested positive. The answer I give them is, I want to get you healthy enough to focus on quality of life. Will you always test positive somewhat? I don't know, but I want to focus on getting you feeling better, which sounds like a politician answer, but it's the best I've got.
I think of it in terms of the immune system, um, and that includes both mold and Lyme. If you have a robust immune system, you could be living in mold and still doing okay. You could have had a tick bite and have Borrelia or Bartonella or Babesia in your body and kind of do okay. You might have no symptoms, you might have only a few symptoms, but you could be relatively healthy if your immune system is robust. However, if your immune system takes a hit, and that hit could have been any severe infection, a viral infection, flu, COVID was a biggie. If childbirth, surgery, a emotional hit of the loss of a loved one or some form of abuse, or you name it, whatever makes that immune system take a hit, it loses containment. That's what we're working with when someone has mold or Lyme or any combination thereof. So the purpose of healing, and I don't think people understand it, is to get enough Lyme and Bartonella out of the body that the immune system reboots itself. It's to get enough of the mold toxin out of the body that the immune system reboots itself. When it does, there may be a little bit of mold toxin in your body, but you can function at a very high level. So the question is, what does cure mean? Does cure mean that you've eradicated every single bug of Lyme or Bartonella that you've been exposed to? Unlikely, but you don't have to. All you need to do is fix it enough that the immune system reboots itself and brings it under containment. We've all been exposed to who knows how many viruses in our lifetime. Some of them are still in our bodies. We can tell that because our immune system still has titers to those various viruses. But but for many of us, we're functioning at a pretty high level because our immune system takes care of it. That's its job. That's what it's designed to do. So my answer to your question is, I don't think it matters that you can get rid of every spirochete that constitutes Lyme in your body. If you've got that immune system rebooted, you can function as a healthy human being, and that's what we're going for.
Yeah, the reason they ask me that is because they assume that I'm going to give them a set time of how long they have to take a tincture that kills Borrelia, for example, and they want me to be able to tell them at 6 months and 2 days you have eradicated all Lyme. You can now stop that. And they ask me, well, am I going to have to do this forever? Am I going to have to get back on? And for me personally, I still do cycle on Bartonella, Babesia, Lyme herbs, depending on symptoms. If I feel like things are coming back, so I've just kind of assumed. I don't look at it as a failure, but I've just kind of assumed that, hey, if I'm under more stress, less sleep, crazier stuff with kids' schedules, I might need to revisit some of that. So you would say that's not a failure. You would just say you have to be flexible with this. And this idea of complete eradication is probably not the goal, or possibly even a realistic goal. Like this Borrelia hides.
You were profoundly affected by it when you were really sick, and now you're high functioning. Um, how do we want to define cure? Um, to me, health is how a human being defines how they need to feel to function at a level that they want to function at. There's optimal levels of health, and there's less than optimal levels of health. You can have a high functioning executive who has migraines and ulcers, but their job is no, just get me well enough that I can get through my next few meetings. That's their definition. My definition of health is more that I want to function at as high a spiritual, emotional, energetic, and healthy way that I can as a human being. I want to stick around for a while. That's so each human being makes that choice for themselves.
Yeah, I think it
Mhm.
goes back to the type A personality. These people want that black or white thing. They want it to say no DNA of Borrelia, no Lyme. They want it negative, negative, negative. But if it doesn't say that, they've failed.
Well, and I virtually never tell anyone how long it's going to take them to get well. What I say is that's up to God. I just work here. Um, but that if you think that you're going to be completely well in a month, that is a completely unrealistic um, way to go at it. And if you want to be disappointed that you're not completely well in a month, I'm not the guy you want to work with. This is going to take time to work on all the different systems that have been affected by these conditions. And I hope you're willing to put that time in. It will be worth it to you. But if you want to get frustrated and go on to another practitioner because I didn't help you in a month, don't even start with me because I'm not the right guy for you.
Yeah, amen. You say in your book a year or more. I think now that I've been in the trenches long enough, I think 5 years is realistic.
For some people, yes. I tell them a year or more just to push back their expectations at least a
Yeah.
year.
Yep. Yeah,
Okay.
well said. All right, well, we got to wrap this thing up. You guys can get the new book, Toxic, second edition, Heal Your Body from Mold Toxicity, Lyme Disease, Multiple Chemical Sensitivities, and Chronic Environmental Illness. That is on Amazon. I'm sure there's other places you can buy it. You should absolutely get the Kindle. If you want to do the paperback, do it. But the Kindle for me is so convenient because you could type in the word Bartonella and go straight to that section of the book. You could put in quercetin and go right to that. Ketamine, go right to that. So I just love the ability to search and go right there. And I really appreciate getting together with you again. And I appreciate what you're doing to educate people. And I hope that one day, maybe in the near future and hopefully in your lifetime, that you could go to the doctor down the street on the corner and he's not going to look at you crazy for bringing in an organic acid or a mycotoxin test or a bottle of binders. I hope that we're slowly waking all these guys up. I know you're educating a lot of folks. I'm now giving a couple talks per year at Mosaic, formerly Great Plains, to try and just get these people up to speed on this and at a baseline. Just know how to look at an oat and know how to use binders. It's not rocket science, but it takes time. It takes time. It takes time. So I appreciate you being here.
Okay. Thanks for having me, Evan.
Thank you.